Hello, this is Sadak Namber from Chicago Arthritis and Regenerative Medicine. In this episode, I am answering your questions. So a super common question that I get from patients who have a new diagnosis of rheumatoid arthritis, psoriatic arthritis, or ankylosing spondylitis is if we're starting them on an immunosuppressive medication, such as methotrexate. Is this something that they'll be on long term? So here's how you want to think about this. Number one, if you have a chronic autoimmune condition or you're recently diagnosed, these conditions are chronic. They're not caused because there's one particular thing that's incorrect or not working. These conditions occur because your immune system is miscommunicating, and instead of recognizing your own body as normal, it recognizes different elements of your own body as abnormal or foreign and is then causing inflammation. It basically attacks them, causes inflammation, swelling, which then causes your symptoms of pain, swelling, and limited range of motion and limited function. So these are chronic disorders that we have a significant but not full understanding of. But we know that for the most part, these are long-term in nature, and they're things that need to be handled in a long-term manner as well. So for most patients, if you're starting one of these kind of medications, yes, you're likely to be on this or a similar medication long-term. Understand that there's certain features that can indicate whether somebody has more aggressive disease or risk for more aggressive disease long-term, including how many joints do you have that are involved. So someone that has 10, 20 joints that are inflamed likely has a much more aggressive disease than someone who has only 1 or 2 joints that are involved. If you have the classic antibodies for that condition, and if you also have imaging findings, let's say an ultrasound that show active inflammation that can actually predict disease damage in the next 1 year or so, that also predicts how aggressive the disease can be. So for most of my patients who need to start these medications, I do tell them that it's likely you'll be on this long term. Keep in mind that in the future, as your condition gets under control, is put into clinical remission with medication, you can then slowly start to taper the medication. That means slowly, stepwise reducing the dosage of the medication and seeing what happens. You're likely not going to fully get off. Every once in a while, some people can get off medication, but you're likely going to be on a lower dosage than what you've required in the past. So yes, likely you'll need to be on these medications long term. Understand that that can be done in a safe and appropriate manner if it's managed by a board-certified rheumatologist, and you can certainly be put into remission with treatment. Hope that's helpful. Until we connect again, have a good day and live well. Bye-bye.